Thank you very much, Dr. Bajpai. So you reflected about the entire evolution of health services and public health in India, starting from Bhur Committee 1946 report. You provided critical reflections on with three national health policies which India has released, and then you also reflected about how the medical doctors have changed their thinking and societal perspective in the last many years. I'm mindful of the time, and there are 22 minutes. So instead of my questions, I think it will be a good idea if we open this for questions from other participants. Maybe we will take two questions at a time, and the participant can raise their hands. We will take two questions. Please also speak that whom this question is directed to, and then we will go for another round of questions.
Sorry to
Priyanka?
Mr. Lahariya, but before the discussion round, before the question answer round, we will like to have a small 5-minute discussion on both the papers that will be conducted by me only. So, and post that, we begin with question answers.
Sure.
So we just quickly try to understand and summarize what both the speakers had to say to the audience. So first of all, thank you so much for this very enriching and a very wonderful paper. Professor Ritupriya was very right when she said that in order to look for answers in the present day, it is important for us to go back and look for answers in the history or perhaps the past. And I think both the papers, Dr. Vajpayee's paper and Professor Mehrotra's paper, dealt with historical insights of in public health, in the public health sector and in the public health movement. However, what was very primary to both the papers, and I would conclude and I will merge and speak, is the word liberation. I think liberation is the key word here. So why do I say that? Liberation, when Professor Ritupriya said that public health sector needs to be liberated from authority of any nature, authority, be it the state, and perhaps and also the kind of health police that she spoke about. So in order for public health to progress, liberation from this kind of authority is very much important. Secondly, she spoke of how liberation of the public health professionals, or perhaps people in this particular discipline, is extremely important. So she said that when it is important for professionals or the public health professionals who enter the discipline to understand what public health is all about. It's not merely it is important to come out of the shackles of narrow-minded thinking. And there is a requirement of confrontation within the self. She also spoke of how there is a requirement to merge different disciplines like statistics, mathematics, and public health all together in order to get a holistic approach to the problems of public health. And when I say liberation was also reflected in Dr. Vajpayee's paper, when he said that in order to get a solution for public health problem, we need to locate the diversity and the differences in society, specifically in the case of India, which is extremely diverse, country in terms of social, caste, race, regional diversity, etc. So the public health problems, or perhaps the public health solution, the policy framework, they need to be modulated as per the requirement of the society. But I'm very interested, and perhaps would also like to know from Professor Vajpayee, that how do we do this? When you say, of course, that's theoretically, it sounds extremely important and it sounds a critical intervention, but as you said, that both theory and practice should happen. So my question would be, how do we do this? How do we address diversity and come forward for a unified, perhaps not unified, but a plausible or an appropriate model of public health problems for the particular class, caste, region, whichever diversity we are locating at? One answer to my mind comes directly is via primary health care. one solution to this is primary healthcare. I may be mistaken, or perhaps I may be wrong, but what I could think of after hearing from you is the solution in primary. We can look for solution in primary healthcare by strengthening primary healthcare structures and centers in the country. Moreover, both the papers theoretic, they both of the papers spoke of theory. How do we they gave a very critical reflection on the theoretical and the academic aspect of public health. They pointed out towards the problem which is not just financial, the problem which is not just about expenditure in public health, but problems which are more uh, at the conscious level. When you say of liberating from state authority, when you say liberations of the public health professional themselves, these are problems which function at more conscious level than at policy level, or what you call at the financial level. So thank you so much. Very interesting insight. Thank you so much again. I would hand it over to the chair and move on for further discussions.
I think before we open for audience question, it will be fair that I invite Dr. Ritupriya and Dr. Vajpayee for maybe 1 minute or 2 minute responses to the observation reflections shared by Priyanka Yadav. Dr. Ritupriya, you may go first, I think.
I think I found it very interesting that Priyanka should look at liberation as the central concept in both the papers, because that's certainly what one could see through. But I don't know whether I communicated that I was talking about public health and its authoritarianism of the state vis-a-vis the public is one clear dimension which is a challenge in the present. And that is part of what could be the future, that public health could get used for authoritarian purposes and through authoritarian means which the public accepts because it sees it for its own good. And Dr. Vikas gave a very good example of that from another doctor friend. So how the plausibility of authoritarianism comes through institutions like public health. And therefore, we need to think differently about health so that we can protect the public from the possibility of using public health for authoritarian ends. How do we preempt or prevent that possibility? Can we do that?
Thank you.
Dr. Vajpayee?
Yeah. See, the question is how do we build that synthesis for different sections of the society? Well, one thing which certainly is not the way forward is that you can't have different care for different kinds of people, maybe the caste, class, or ethnicity or region. The idea is to build a singular system in the sense which is singular in terms of principles, in terms of principles, though forms can vary as per local needs and diversified needs, but which has the singularity of principle, that the system is to be sensitive to the needs of sections of the society, and that it will think consciously about it and provide for it. Now, as to the way forward of doing it, well, one thing is that the larger people's movements for their livelihood issues, for their bread and butter, for their social survival, social economic survival, their dignity, these struggles which are going on, willy-nilly, these struggles, they pave the way for such an understanding to evolve, even in terms of health. Now, as regards, the point is while these struggles are going on, there is a need for the health professionals, for public health professionals, for doctors or specialists of various kinds, for paramedical workers and all, to be cognizant, to be made cognizant of these varying needs of the society. Okay, and there is a need the need for them to respond to specific aspects of healthcare, the way it alienates healthcare from the people, and that need for them to respond to such things should be emphasized, and there should be attempts to bring them into struggles for that. For example, one of the issues we always took at various levels and wherever possible was this abolition of user charges in healthcare. Okay, I've been part of it ever since I was a medical student at various levels. Now, the issue of privatization of healthcare, issue of privatization of medical education. Okay, what this does to the people, what it is doing really, and how it is playing out in the society. How is it wreaking havoc with the people's health, ability to access care? Okay. So these are the kind of issues, because one is at the level of theory, you can identify very magnanimous ideas and theorize them. But at the level of practice, these ideas have to be concretized into certain actionable demands, action points around which you can mobilize people, around which you can mobilize the larger medical fraternity. And when I say medical fraternity, I'm not just talking of doctors and all. I'm talking of medical, paramedical, and all the people who are concerned with that. So at practical level, these issues need to be identified, and we need to work in that direction, towards that direction. This is what we've been trying to do, and I hope the coming future we will be enriched further in our understanding.
Thank you, sir.
Thank you very much, Dr. Bajpai. So now floor is open for participant questions. Please raise your hands. So while we wait for some of the questions, I will reflect, and maybe a question for both.
I had a question.
Yes, please. Yes, please go ahead.
Am I audible? I'm sorry, again, I'm having trouble with my internet. But this question is more relevant to Dr. Vikas Bajpai, I feel. I wanted to understand what is the scope for traditional medicine systems in the future of healthcare? We've talked about technology, we've talked about social movements, we've talked about a lot of things. I also wanted to understand, is there any scope for a fusion of traditional and modern medicine systems in the future of public healthcare in India and elsewhere? Thank you.
Before Dr. Bajpai answered, if there are more questions, we can take one round of questions, and that will save us time. Dr. Manindra ji is raising hand, please.
Thank you for this wonderful session. And the best thing of the session is that it has raised high philosophical issues along with concrete practical issues. So on the one hand, the session is suggesting that there is a politics of knowledge, and we need to intervene in that politics of knowledge and think of plurality of knowledge system coming together without rejecting one or the other, working on the strength of all of them. And the realist version is modified further. The modification goes very well with the creative theory group, which is actually based on our interaction with critical realism group, which is talking of plurality of epistemologies, but having links and constantly struggling for a universal, but that universal itself is not constant. That universal is constantly emerging and changing. So emergentist universal. I think this is a broad philosophical frame on politics of knowledge that we work with. So I think that's a wonderful theoretical and philosophical intervention. A lot of people ask us that how This 3 days conference, different panels on different themes are interconnected. I think most of the panels have these common issues coming up. They are throwing the challenges, our larger dissatisfaction with the existing system, and practical problems and theoretical and philosophical domains where we also want to enter. So thank you very much for that. There are a couple of things that I think I need to ask. One is that, why do you think, Professor Vajpayee, that this, despite the fact that public health is such an important thing, and we had in the initial few years after independence, a vibrant public health system, which collapsed badly in last few decades, and still there is no movement about it, or other movements, they are going on. They also do not raise any issue about public health. This is a very serious issue. We were contemplating that if somebody wants to do a radical politics in Bihar, probably two sectors are there which could be picked up immediately. One is public health, other is education, public institutions of education. But unfortunately, none of these issues are part of agenda of any political party, including the extreme left political party. They also don't talk about the public health. Why this disjunction is there? This is one. Second, you raised a very interesting question about education, health education, means the medical college education system. I'm witnessing this. Somebody very close to me has just done his MD, and we talk almost every day, and horrible stories I hear about the hospital. The young boy who entered as more or less radical left has come out with huge frustration, and now he thinks that there is no way out except to get into private sector and earn some money. So much of humiliation happens inside the hospital system. So much of valueless education, valueless medical education is going on in this country. Do you know any good study on the values being propagated by the health educators? I would like to really read that, or I'd like to get your reflection on that. So how do we counter that? Well, unless we do this, raising this kind of movement of public public health professionals, or connecting that with the radical movements all around, that seems to be very difficult to handle.
Sure. So my first request to you would be that please let me have an opportunity to meet that young, bright, young, frustrated doctor, and I hope I can convince him that there are ways out. Okay. Now the reason. Now first, the question about this traditional medicine. You see, I do see a role, for precisely the reason that traditional medicine is there where modern medicine is not there. Okay, that is, it is close to the people. Okay, it is there with them in the thick and thin of life, and where modern medicine is not there. At the same time, I am also of the opinion that I mean, I am never able to get myself to romanticize traditionalism in any way. Okay. Well, I do believe that, like all other people in every other part of the world, Indians were equally capable or equally incapable of devising ways and means for providing care to themselves, including medical care for themselves, as per the given knowledge at any particular point in time. Okay, so definitely some traditions which have continued for a very long period in history, they cannot be debunked lock, stock, and barrel. Neither, I think, in view of the modern knowledges or the knowledge that has been gathered with the development of science, technology, and progress in various fields of life, in view of that, neither is it true that all of what is traditional can be accepted lock, stock, and barrel. Okay, so now the point is, how do you remove the chaff from the wheat such that you are able to save the kernel? Okay, and I think most of the contestations which arise, even between me and Dr. Ritupriya over here, and they arise often on this point of how to weed the chaff from the kernel, from the grain. Okay. So that is a longer topic of discussion and all, but then yes, I do see a role for traditional medicine. Okay, and provided it is, and this role can prosper only if it is seen in the process of learning from from each other. Okay, so then only will it be possible that we can actually realize this kind of synthesis at any level as well. So that is the one thing. Now, as to the question which was raised by Professor Manindra Thakur, I wish to say one thing. You see, healthcare does become an issue in US. Healthcare does become an issue in UK or in France or in other developed countries. And there are specific reasons for this. And if I may point out the reason, it is something like this. Many times, as and when, wherever I have had the chance to go to villages and talk to people and all, I often ask them one question. What if you were asked, that government were to ask her, what would be your first, say, 7, 8 priorities in life, or wishes in life, which you would wish to be granted by the government, were the government ever to make some such offer? In many of the villages and all, among their first few priorities would be something like, the government should improve the irrigation. We don't have water for irrigating our plants, or we don't get loans, or some such issues which are connected in a very, very immediate sense to their ability to be able to live, to safeguard their livelihoods. Okay. And invariably, health does not really figure in the list of priorities and all which they say. Now, the point is, how do we look at it? Do we see that people don't want health, so let them not have health? Or we see that where is the people's lives at what level is it in the present? When people are struggling for their daily bread, from one meal to another, they are struggling simply to be able to live. I think if I were also in such a condition, I would rather move with the presumption that I will not fall ill. I will not fall ill today, I will not fall ill tomorrow, or maybe for another month or a year. Because I cannot afford to make provision for my illness separately in advance. For most of the people, illness comes as an inadvertent thing, as and when it happens, and then solutions or resources have to be marshaled to tackle this emergency as and when it arrives. Okay. For a majority of our people, they cannot plan for their health per se. Okay. But yes, they are under obligation to plan from where the next meal will come, or as the situation is arriving. How will they have means to buy any meal, whether they will be employed or not? Okay, so it is something like, that only if my survival is ensured, will I be able to think of something which goes beyond mere survival. Okay, now insofar as maintaining functional health is concerned, I think unless one is really very sick or impaired by a particular kind of a health problem for which he or she has to take certain medicines or medical aid to be able to maintain a minimal level of functionality, that is another situation. But in the absence of any such identified condition, we maintain functional health by all other means which do not categorically fall in the sphere of health care per se. Okay, we may go for a walk, we may do some little exercise, or simply that we may have our food as and when we can have an opportunity to have it. So I think that is one important reason why health never really becomes that kind of an issue. See, just, I mean, if I were to place myself, not say in the position of a landless agricultural labor, but simple youth in a district of Bihar who was done graduation or who was done high school, who was taken some form of a coaching for some getting certain kind of job, and I'm sitting at home. You know, my immediate need is that I be able to get that job. And for a marginal peasant also, his overriding concern through the year is be able to have at least that much of crop which will be able to bide his family over the most testing months of the year in terms of food security.
So Dr. Bajpai, thank you very much.
So
for your
there
inputs.
are many other reasons, but I think I have just discussed the most important.
Yes, and thank you very much. I'm aware of the time, and organizing team is saying that. So the last 30 seconds for Dr. Ritupriya, and then we wind up.
Thank you, Dr. Chandrakant. I think I just endorse what Dr. Vikas has just laid out in terms of why people are not standing up and demanding healthcare. But I also want to add to that this does not mean that they don't think about health and healthcare. They do. It is for us as researchers to understand, to capture that understanding and communicate it to the policy making and those who are shaping the structures that influence the way they are able to access healthcare. So this understanding is a role for critical thinkers to figure out. That is what is not surfacing. It does not mean that people are not doing. In fact, the major dichotomy one sees today is that what the state is providing and what people are doing are two very different things. People are doing things for health. It's not that they're sitting back when they're only looking at survival and livelihood. They're also taking steps for healthcare, which are very different from what the state is planning. And therefore, we need to recognize this great divide and try and bridge that divide. I see my role as one of a bridge between these two. And that's where I think we need to find our methodologies and theories to be able to do that kind of a bridge. Thanks.
Thank you very much, Dr. Ritupriya. So I would not attempt to summarize. I'll say that every single minute of talk by our esteemed panelists is worth listening. So please go back to the recording and listen, watch. And of course, this is a dialogue which just has started, need to be continued. Thank you very much for to the panelists and everyone who joined. And thank you very much. Over to you, Priyanka.
Thank you so much, everybody. I really would like to thank the chair, the speakers, and also a lovely audience for being a part of this panel. And I also see your participation in our further sessions, which are, which are scheduled for the day. Thank you, everybody. Thank you. The recordings will be available. And again, the sessions are being live streamed. So everybody can go and have a look from there as well. So thank you so much. Thank you.
Kindly share the link of the recording.